Hi, I'm Sierra. I'm a third-year nursing student about to go into my maternity and peds rotation, and one of my most asked questions is what do I bring in my clinical bag and how I make my med cards. So I thought we could do a quick and dirty and go through both in the same video. So let's do it. The first thing that I keep in my clinical bag is my clinical binder. It is literally a 1-inch binder from the dollar store that cost me probably $1. I keep all of my clinical resources in here, all of the feedback that I get on my charting, any information that my instructors provide me, put it all in one place. I take it every single clinical shift, so I have everything in here. I also have this little pocket card that my university provided me for head-to-toe assessment, and then my med cards. I will show you guys a closer look at what they look like, but they are literally printed on white plain paper. I make them in Google Docs, and I laminate them with electrical tape on my floor the night before clinical.
Okay, these are my med cards that I use for clinical. They are nothing fancy and nothing pretty, but they work. I sort them by medication, mechanism of action, uses, onset route, and then contraindications and adverse effects. And they help so much to just get a good understanding of a whole variety of medications. As you can see, I have a bunch here, and this isn't even all of them. So I highly suggest just making your own. It helps for your learning, and then I laminated them just for safekeeping.
Okay, so now we'll get into my clinical bag. I use this bag from Scrubs. It is huge. It has so many pockets, so it's perfect for lab, clinical, and work, which is what I use this for. And I bring the same things to all of those places, and they're all in here. So first things first, my stethoscope. I always bring that to lab, clinical, and work, so that's good to have. I put my wallet in here. Obviously, that moves around. My laptop, I don't always bring to clinical just in case I don't have like a safe place, but today I was just at school, so I have my laptop and my iPad, a notepad of some sort. For clinical, I have a little pocket notebook. For school, I use a little bit of a bigger one in case I have to take bigger notes. And then gum, my badge reel. I always bring an extra one of these as well because I've had it break at work, and that was not great because then I had to carry around my badge to let me in places. Then lip gloss, some Aquaphor because my hands get so dry, especially during the winter. Advil, of course. Then just a little kind of a rescue bag with like lip stuff. Also, if you're looking for a clinical bag, the Scrubs one is so good. It zips all the way across. It's got room for water, coffee, all the things. So that is what's in my clinical bag and how I make my med cards. I highly suggest just buying a cheap binder, putting everything you need in there. Don't waste your money on resources and things that you do not need. You can make them yourself, and it helps with your learning. So good luck if it's your first year, and bye.